to answer the first question, I've like from a hypertrophy standpoint, you can make meaningful gains. I think with just a couple of sets per week, 1 to 2 sets per muscle group per week. But from what the current literature shows, like if you were to just up that to like 4 to 6 sets per muscle group per week, or let's say 3 to 6 sets per muscle group per week, you may be looking at substantially more gains without necessarily having to commit that much more time. And I think that, okay, sure, if you're the one guy who's so busy and the only thing you can do is 1 to 2 sets per muscle group per week, and you don't have the extra, I don't know, 10, 15, 20 minutes per week to dedicate, to your whole training, fair enough. But just being in the 3 to 6, being between 3 to 6 sets per muscle group per week, I think is a solid way to ensure that you're not just making some gains, but that those gains are meaningful. So, as far as strength goes, things look very similar. Like the volume prescription would be similar. Obviously, for strength, if we know that it's probably best to opt for heavier loads and potentially leave a few more reps in the tank than you would for hypertrophy sets. So those 3 to 6 sets for hypertrophy can be in any rep range you like, as long as you are very close to failure, and I'm talking like 0 to 2 reps in reserve. For strength, ideally, you'd be in the 1 to 5 rep range so that you can use a weight that is heavy enough. And although our studies did not look at sets terminated at far from failure, but rather very close to failure, because I thought, okay, we're having these people do so little volume that it's probably best if we keep specificity very high and have them, lift heavy, like near max loads every day, so that they can get better, essentially at the test that they're being tested on, which is a 1 repetition maximum strength test. But I think that you could take the concept of the minimum dose, do 3 to 6 sets per lift per week in the 1 to 5 rep range, leave 2 to 3 reps in reserve, and make meaningful gains, which in our studies we defined by asking powerlifting athletes and coaches what they deem as meaningful. I think as far as like a powerlifting total increase, meaningfulness for 6 weeks was set at around, take this with a pinch of salt, at around 38.5 pounds. I had to convert from kilos. But it's important to also understand that will depend on your strength level. It will depend on your personal goals, personal experience. Maybe it may be lift specific. So for me personally, if I was to gain 12 kilos, 12.5 kilos specifically on my deadlift and reach 300, and that's taken some years now. Obviously, I haven't been really focusing on chasing that, but that increase for me would be meaningful. But in order for us to G-check, as they say in science, ourselves and make sure that, the meaningfulness standards of the coaches and athletes were not just random, because you could, that's a risk there. Like the risk there is that we could have just asked some random coaches and athletes, and they said, this number seems like a nice threshold cutoff point for meaningfulness, but in reality that doesn't really make sense. But we actually looked at the amount of strength gain required in order to move up one placing in IPF competitions. And you can find all that, like the detailed analysis and the methods for that on the paper itself. If you go to minimumdose.training, if you type that in your browser, it will take you to a Linktree sort of page, and it has all those studies there. And we essentially compared what the coaches and athletes said with, it was like subjective versus objective. And those pretty much, they didn't align perfectly, but they were very close. And which was cool to see, because it's common to talk about statistical significance, and we've seen that in the past few months as well with some studies that have come out, and people are like, oh, this wasn't statistically significant, but then it's like, yeah, guys, but if we look at the actual numbers, it may be of practical meaningfulness. The same way if I said, oh, these guys gained X amount of weight on their squat, bench, and deadlift, and they were elite lifters, but it wasn't statistically significant, a lot of us, including myself, may turn around and be like, yeah, okay, it wasn't statistically significant, but this is an increase that I, as a coach, would consider practically very meaningful, especially in specific populations. The same with muscle growth. If you were to look at bodybuilders like advanced bodybuilders, and you saw that they gained some muscle mass that could potentially come up as statistically insignificant, I do feel like a lot of both coaches and athletes would turn around and say, yeah, it didn't reach statistical significance, and that could be because of a plethora of reasons, including sample size, maybe the statistical approach that was taken was not the most appropriate, and so on and so forth. But they may turn around and say, you know what, like half a pound or 1 pound gained in X amount of time for those individuals, that's insane.